Comparing the healthcare burdens in the USA, Japan, and Taiwan from cardiovascular diseases, CVD care linked to obesity and diabetes, using the viscoplastic energy model of the GH method Math Physical Medicine. Number 1203, VMT Sharp 593, January 12, 2025, by Gerald C. Shu. Category CVD. Abstract. Key message: when evaluating the impact of cardiovascular disease CVD, influenced by both obesity and diabetes, the loadings or burdens on the healthcare system in three nations are as follows. Japan's efficient prevention strategies and low obesity rates result in the least healthcare system burden 3,987 or 1.0, followed by Taiwan's moderately effective programs 4,530 or 1.1. The United States faces the highest burden 12,726 or 3.2 due to its dangerous obesity, epidemic and treatment-centered healthcare approach. Brief introduction. This public health study analyzed the impact of cardiovascular diseases, CVD influenced by both obesity and diabetes in three selected nations: the United States, US, Japan JP, and Taiwan TW over the period from 2010 to 2024. In addition to traditional statistical methods, the author also employed the energy model of the viscoplastic medicine theory, VMT, to uncover certain hidden biophysical phenomena. One key finding was the total VMT energy levels, which reflect the burdens or loadings on the healthcare system, associated with the combined effects of these three selected medical conditions. Summary: average disease figures from 2010 to 2024 for the United States, Japan, Taiwan are: obesity prevalence rate, 39%, 4%, 22%. Diabetes prevalence rate, 10%, 8%, 10%. CVD prevalence rate, 2.745%, 1.493%, 0.974%. The VMT energy contribution ratios of obesity and diabetes to CVD in each nation are as follows. US obesity 79%, diabetes 21%, obesity is greater than diabetes. Japan JP obesity 33%, diabetes 67%, diabetes is greater than obesity. Taiwan TW obesity 69%, diabetes 31%, obesity is greater than diabetes. These findings highlight distinct patterns in the biophysical energy contributions of obesity and diabetes to CVD across three different healthcare systems. The total VMT energy levels for each nation are as follows. United States 12,716 or 3.2, Japan 3,987 or 1.0, Taiwan 4,530 or 1.1. The following detailed descriptions provide explanations for the differences in healthcare system loadings or burdens among the three nations: the United States, Japan, and Taiwan. Healthcare system efficiency. Japan energy level 1.0, low obesity rates, only 32.6% of men and 19.9% of women are overweight or obese. Strong prevention, systematic screening programs for early detection of cardiovascular risks. Resource allocation, lower coronary heart disease rates compared to Western nations, despite higher stroke rates. Taiwan energy level 1.1. Prevention programs. The 888 plan targets hypertension, hyperglycemia, and hyperlipidemia with 80% control goals. See biomedical information section. Low metabolic obesity. Prevalence of metabolically healthy obesity is just 8.6%. In Taiwan, only 8.6% of obese individuals are considered metabolically healthy. This suggests that the majority of obese individuals in Taiwan experience significant metabolic dysfunction, contributing to increased risks of cardiovascular diseases, CVD, diabetes, and other health burdens. Cost-efficient healthcare. National health insurance ensures extensive coverage and standardized care pathways. United States energy level 3.2. High obesity prevalence. 73.1% of adults were overweight or obese as of 20,172,018. Expensive diabetes care. Elevated costs due to hospitalizations and high-priced prescriptions. Obesity-driven risks. Inflammation, insulin resistance, and direct cardiac effects increase CVD burden.